Hey guys, it's Marge once again. Welcome back to my YouTube channel. And for today, I'm going to be talking about a nursing related topic. And I will be sharing with you guys today 15 different highest paying specialized nursing jobs in the country. So if you have noticed, I mentioned the word specialized nursing jobs. This is because the jobs I'm going to be talking about today are jobs that are applicable to nurses who have experience. So to those who are a new grad nurse, or if you just got your license to practice as a professional nurse, the first thing you have to do is go and apply in any hospital out there and get your basic training as a nurse. You have to work as a floor nurse or bedside nurse for a certain amount of time, typically about a year or two. After completing about a year or two of nursing experience, then if you decide to specialize on your profession, then this is a very good guide for you guys to choose from if you want to become a specific nurse. And I'm also going to be mentioning the pay that you're going to be getting accordingly with all of these nursing jobs. Okay, so the pay that I'm going to be mentioning today is just an estimate pay, meaning it could be different. It could be higher, it could be lower, and this all depends on the state you live in, the hospital you work for, and the organization. And actually, wherever you live here in America, the pay is always different anyways. There are states that are paying higher compared to other states because some states require a higher cost of living. Therefore, you get to be paid more. If you live in a state with a lower cost of living, then normally you don't get paid as much as those people that live in, for example, California and New York City. So what I'm gonna do is I'm gonna start from the bottom, so number 15, all the way to the top, number 1, and we are going to rank this according to pay. Okay, so let's go ahead and start with number 15, and that is no other than a health policy nurse. So with a health policy nurse, you get paid typically around $34 to $35 an hour, which gives you an income of about $71,000 to $72,000 a year. And again, that's just an estimate. So what is a health policy nurse? You actually have to work with healthcare policies that has to be implemented in either the public the community, or in a certain organization or hospital. So normally these are nurses that are passionate about public health or public health policy. So you can either work with the occupational health, infection control team, or you can also work with case management. On a higher level, you can also work with the international health organizations such as the WHO or World Health Organization. So you're not basically working bedside, you're not working directly with patients, but you're working with the organization that has to implement new rules that has to be advocated in a certain community or in a certain hospital. And then later on, you're going to have to do some research, you're going to have to implement this, you're going to have to evaluate it down the road. So that is what a health policy nurse does. Number 14 is a critical care nurse. Critical care nurse, which means you have to work in either the ICU or the emergency room department. So to become a critical care nurse, it says in the article that I read that you can get about 36 to a little over $36.50 or maybe $37 an hour, which gives you a total annual income of about $76,000 to $77,000 a year, which I do not agree with completely. It is because this pay may be applicable to states that have a lower cost of living. That is true to those areas. But if you live in states such as California and New York City, I know a lot of critical care nurses that gets paid about $70 to about over $100 an hour. So that is a big difference. So to become a critical care nurse, you have to be highly skilled. You have to possess a really good critical care skills, and you're going to be working with a very highly stressed environment. You're going to be dealing with patients that are facing life and death situation Therefore, you need to be paid more because your skills and your training are very, very difficult as compared to other nurses in the floor or in the hospital itself. Okay, so now we're down to number 13, and that is no other than informatics nursing or informatics nurse. So basically, it is technology meets nursing. It is said that you can make about $37 to $38 an hour, or roughly about $79,000 to $80,000 annual income to become an informatics nurse. And it is also said in the survey that this is one of the most in-demand nursing jobs nowadays, and the growth in this nursing field is actually growing really good as of the moment. Okay, so what does an informatics nurse actually do, or what do they perform? Basically, these are nurses that are very good in technology or computers. So you have to be computer literate, because part of the job or part of the task that they perform is that they teach the units, the nurses or the doctors, how to perform tasks that is computer related, such as EMRs or electronic medical records, documentation. Sometimes they are also the ones who are in charge of the hospital staffing, bed flow management, and stuff like that. So you deal with the technology side of the healthcare industry. You don't work exactly bedside. You're mostly working anything that has to do with the healthcare and computer, or healthcare and technology combined together. Okay, number 12 is no other than a nurse educator. So to become a nurse educator, you can make an income of about $83,000 annually, or that gives you roughly around $39 to $40 an hour. And it could also be a salary-based job. Nurse educators are nurses who wants to teach. For example, clinical instructors. So when you're in nursing school, when you go to the hospital, you have somebody that will guide you clinically, and these are our clinical instructors. Also, nurses that teach like ACLS, BLS, all of this continuing education that the nurse needs to comply with in the hospital. The nurses that are teaching the other nurses or doctors are what we call the nurse educator. And yes, there you go. You can make around $83,000 a year or annually, and that gives you about $39 to $40 an hour roughly. So down to number 11 is no other than a gerontological nurse practitioner, which gives you an income of about $89,000 to $90,000 annually, or that's roughly around $43 to $44 hourly. And to become a gerontological nurse practitioner, you have to specialize in taking care of the geriatric patients, or our elderly patients. So normally, to become a gerontological nurse practitioner, you need to have your, of course, bachelor's degree and get your master's in nursing, and then eventually have to be a certified gerontological nurse practitioner. So there is quite a few steps to become a gerontological nurse. The jobs that you can actually get becoming a GNP or gerontological nurse practitioner is to work in either hospital. You can also work in clinics, urgent care, long-term care facilities, nursing home, retirement communities, and places where you can actually find the elderly population. Okay, number 10, RNFA, or a registered nurse first assist. So with this kind of job, you can make an income of about $96,000 to $97,000 annually, or roughly around $51 to $52 an hour. So I have not really heard a lot of nurses that specifically does this kind of job, the RNFA. I have never met anybody in the institutions that I've worked for or the area where I live at. I guess this is a very specific job. And if I think of an RNFA, what comes to my mind are OR nurses. Based on the article that I read, an RNFA To become one, you have to be a bachelor's degree, and you have to have specific certifications that will give you this specific function. You can actually work in ambulatory surgical centers or the same-day surgery outpatient centers and ORs. So what you're gonna do, your task that you're gonna perform is to assist the surgeon while he is doing the operations, kind of like a scrub nurse. So that's what I think about of a an RNFA. So, number 9, which is the most popular nursing specializations in the country. I know that there are a lot of this kind of jobs out there, and a lot of nurses are actually pursuing this specialization in this field, and that is no other than a family nurse practitioner, or an FNP. So a family nurse practitioner, according to the article that I've read, gives you an annual income of about $98,000 to $99,000 a year, which is close to what an RNFA makes. They're very close. It's about $97,000 to $99,000 a year, or that's roughly around $47 to $50 an hour. But for an FNP, this pay actually is not very accurate. It again differs in every state, and it differs in every hospital. They are mostly salary-based income, and at the same time, it depends on how long you are functioning as an FNP. So what is an FNP? An FNP, which stands for Family Nurse Practitioner, is super popular here in America, and it is one of the nursing jobs that is very close to a function of an MD or a doctor. You become a FNP. To become one, you actually need to go back to school. Normally, it takes about 2 years to finish the entire FNP course, and you have to eventually become a board certified FNP. Your function is very, very much similar to a doctor. You can work in a hospital, in clinics. You can have your own clinic. You can run your own clinic. You have your own patients. You function independently, and you can prescribe medications. You can assess the patients, admit, discharge. Basically, you are like a doctor. You can follow up their treatment. You just basically do stuff that a doctor does. And there are quite a lot of nurses in the hospital setting as well as in the clinics out there. So you can specialize in different kinds of nurse practitioner program. So it's one of the most in-demand and competitive jobs in the country nowadays. Okay guys, so we're halfway down, and we are now in number 8, and that is no other than a nursing administrator. So nursing administrator is like the backstage operation in nursing. You don't typically deal with bedside patients. So you're working in the office. Mostly you're doing management jobs or HR functions, and with this kind of job, it is said that you can make roughly around $100,000 a year, or it gives you an hourly income of about $48 to $50 an hour. So you are mostly dealing with paperwork, HR functions, management issues. So managers can fall under this category, you know, positions that has to do with managerial what do you call this, managerial stuff, or managerial performance. Okay, number 7, pain management nurse. Okay, so a pain management nurse is actually quite popular as well. It is a very specialized nursing job. You can make over $100,000 a year, usually around about $102,000 a year, which makes about the same, you know, about $48 to $50 an hour. So this kind of job, you are just dealing with pain management. per se. So you're dealing with patients with either acute or chronic pain conditions. So you are determining the amount of pain the patients have, and according to that, you're going to determine what kind of medications they need, what is the proper course of treatment. You are very focused only to the pain management of the patient. So normally you have patients that have chronic pain conditions, as well as patients that just came out of surgery. So what you're gonna do is read on their past medical history, their medication, home medications, and determine the amount of pain meds that they should be taking while they are in the hospital. So you can work in a hospital, you can also work in clinics, you can also work in a surgical centers, anything that requires a pain medication. You can also work in rehab centers. So those are the jobs that you can do working as a pain management nurse. Right, so number 6, NICU or NICU, which stands for Neonatal Intensive Care Unit Nurse, or a NICU nurse as we call. So NICU nurses make around $102,000 to $103,000 a year. Again, that's around $50 to $51 an hour. So a NICU nurse or an NICU nurse is just another kind of ICU nurse, but you are just dealing with neonates, so newborn babies. It is a very critical job because, you know, babies are more different and more difficult to take care, in my opinion, because babies don't talk. You have to observe how they are. You have to be very good in neonates, in babies. They're very fragile, they're very small, and you can easily like break their bones, you know, if you resuscitate them. So to become a NICU nurse is actually something very challenging. So again, to become an NICU nurse or a NICU nurse is very popular. You can work anywhere. You can work in small or big hospitals. As long as they have a NICU setting, then there you go, you can grab a job or an opportunity to work as an NICU nurse. If you are someone who is into neonates or babies, then there you go, you can go ahead and become a NICU nurse. Okay, number 5 is a certified nurse midwife. And a certified nurse midwife is another specialized nursing job which makes a lot of money. They make about $108,000 to $110,000 a year, and that gives you an hourly wage of about $52 to probably $55 an hour. It is a very specialized job because you only take care of moms, you know, pregnant patients. You also deliver babies. So if you have the love for obstetrics and gynecology, labor and delivery, then there you go, you can specialize on becoming a nurse, certified nurse midwife. Okay, so besides getting a good amount of experience in a labor and delivery unit, you also need to be a certified midwife. So you have to go back to school and get some certifications to become a midwife slash nurse. So that is how you become a certified nurse midwife. And this is just like a nurse practitioner. Eventually you can actually run your own obstetrics clinic. You can have your own patients. You can take care of your own pregnant moms, do like prenatal checkups and stuff like that. So it is another independent nursing job that you can practice down the road if you have the love for the obstetrics and gynecology branch of nursing. Okay, number 4 is no other than a psychiatric nurse practitioner, or psychiatric nursing in general is actually a very highly paid nurses here in the US. I guess it's because not a lot of people are into psychiatric nursing, but once you get into this field of nursing, you are going to be paid really, really good here in the States. A psychiatric nurse practitioner is believed to make around $105,000 to $107,000 annually, which gives you roughly around $50 to $52 an hour pay. Obviously, when we say psychiatric nursing or psychiatric nurse practitioners, these are nurses that specialize in taking care of patients that have mental disorders. And along with patients with mental disorders, they also take care of patients that have substance abuse issues. It is known that people with substance abuse issues later on develop some psychiatric disorders. So they kind of like go hand in hand. So if you do have substance abuse issues, you will most likely also be followed by a psychiatric nurse practitioner or a psychiatric doctor or psychiatric nurse. To become a psychiatric nurse practitioner, just like any nurse practitioner program, you have to get your master's in nursing, then go get your NP degree, which specializes in psychiatric nursing, and then you can eventually become a psychiatric nurse practitioner. But beforehand, you definitely need to have a very good foundation in the psychiatric unit. You have to work as a bedside nurse or as a bedside psychiatric nurse for a while in order for you to be successful in becoming a psychiatric nurse practitioner. Also, you can get a job in a hospital or in any psychiatric setting or a mental health institution. All right, so we are now down to number 3, and that is no other than a clinical nurse specialist. So a clinical nurse specialist is actually something that is quite popular these days, and a lot of large or big hospitals or teaching hospitals has this kind of nurses around. You find them in every unit, and every unit you work at that has a CNS, they are actually nurses who kind of like educate the nurses in the unit. So they are the more specialized and more trained nurse in that specific unit. So if you work in an ICU and you are an ICU CNS, so whenever there is an education or whenever there is something new that has to be taught to the nurses in the unit, you are the one who's going to have to teach the nurses in your unit. So before you actually go to the manager, because usually the manager will just work on managerial functions in the unit or in a hospital. When you have any questions about education, continuing education and stuff like that, the CNS will be the one that you have to approach. So the CNS is like the teacher of the unit. So they teach the nurses on continuing education or anything that pertains to their practice in that specific unit. And it is believed that they also make a lot of money, and typically they make around $107,000 to $108,000 a year, which makes around, I'd say, $50 to $55 an hour. And it is also a salary base, and they usually just work day shift. They usually work 7 to 3 p.m. So it's an 8-hour job. They do Mondays to Fridays. Okay guys, I'm really getting short of breath, and we are down to number 2. And number 2 is a general nurse practitioner. So a general nurse practitioner makes around $110,000 or about $112,000 a year, or that is roughly around $53 to $55 an hour. A general nurse practitioner is quite popular, and a lot of them works in hospital setting. They do work directly with patients. Most of them work during the night shift because a lot of them do the on-call job. So they run the entire hospital. Mostly they work in med-surg settings. If there is any thing that happens, such as code blue, rapid responses, or code 10, stuff like that, they usually call the general nurse practitioner. They are on call and they give orders, or they actually work along with the staff nurses. And it is very similar to a family nurse practitioner. The only difference, I believe, is that a general nurse practitioner works just like a general doctor. You can work in a medicine unit, in an ortho unit, or any unit. You can just like hop from one unit to another, or you can just work in all those units at the same time. It's very generalized, it's very generic, but you have the option later on to specialize and make your practice more narrow. General nurse practitioner, you just generally take care of everybody, and you still function just like a doctor. In the absence of the doctor, you do admissions, you prescribe medications, you also treat patients, you give orders. So it is a very stressful job, a very independent job, because you do a lot of jobs that most of the doctors do anyways. Hallelujah, we're down to number 1. And I guess you guys are very, if you're already a nurse, I guess you already know what I'm talking about. And if you're not a nurse and you are excited or curious to know what is the number 1 highest paying nursing job in the US, that is no other than a certified nurse anesthetist, or a CRNA, certified registered nurse anesthetist. They are the highest paid nurses in the entire country, no matter where you go, whether you go to a to the south, to the Midwest, to the east, anywhere you go, a CRNA is definitely, no question, the highest paid nurses in the industry or in the field of nursing. Why are they highly paid nurses? To become a CRNA is very tough. There are so many steps, there are so many requirements. It is a very highly skilled job to become a CRNA. So first, you need to, of course, graduate in a nursing school. You need to get your bachelor's degree, you need to get your master's degree, you need to get your solid 2 years critical care experience. And then after you get that solid 2 years critical year experience, you want to become a CRNA, you have to apply to a CRNA school. And not everybody that applies to a CRNA school gets accepted. There are so many standards that you have to meet in order to get into that program. Once you get into that program, you have to be a student, a full-time CRNA student for 3 years. So it is so hard to work and go to school at the same time doing CRNA. A lot of times you have to have a good amount of money saved in order to go to a CRNA school, because not only is it difficult, it is super expensive. So what do CRNAs actually do? CRNAs are very highly skilled nurses that administer anesthesia. So most of the time you see them working in the OR. They work along with the surgeons, anesthesiologists. They also work in dental clinics. They work with dentists, podiatrists. You as a CRNA will deliver anesthesia to the patients. And in the hospital, it is the anesthesiologist that does this. So again, it is a very critical job that you have to do. That's why it is very hard to get into that program. You have to be trained in a critical care area before you can actually be accepted into the CRNA program school. If you are curious of how much a CRNA makes, they make around $180,000 to over $200,000 a year. So that is a lot of money. Not everybody is able to make that amount of money. I mean, it pays to go to a CRNA school if you really like it, because when you start working, you're going to be paid really good. So not everybody can make it to a CRNA school. Not everybody can become a CRNA. It has to be a dedication from you. You really have to like it. And you know, just going through the school, just going through the program requires a lot of money, a lot of time, and 3 years solid school. So you literally have to quit your work, go back to school, and just go back as a student for 3 solid years to become a nurse anesthetist. Okay, there you go, you guys. We are done for today. Those are the 15 highest paying specialized nursing jobs in America, and I hope you guys find this video to be helpful and informative. If you're a nurse who wants to specialize in your job, then there you go. We have so many options. There are so many things you can do becoming a nurse here in America. And if you are in school and you are considering to become one of any of these specialized jobs, then you have a lot of time and a lot of experience to work for before becoming any of them. If you want to become a nurse anesthetist, go for it. But if you want to become just a bedside nurse for the rest of your career, that is totally fine. I wanted to share this because I wanted people out there who are interested in nursing to know that in the US, specifically here in this country, there are so many options you can do to work as a nurse. It is a very competitive job and it's very stable, and at the same time there are so many things you can do in this job. You don't have to be stuck working bedside or working in a hospital. You can do anything. You can go and work in different, you know, healthcare settings. You can work remotely. You can just do so many things. So yeah, there you go. I hope you enjoyed this video, and I will see you guys next time. Bye.